Well, concerns about the second wave, combined with the harsh winter months ahead, have raised the alarm on the mental health of medical workers. To discuss this, I'm joined by Dr. Dan Chisholm, Mental Health Programme Manager at the World Health Organisation's Regional Office for Europe. Thank you very much for speaking to us. Look, we just saw the situation, the critical situation in the hospital in Lyon here in France. What are the mental health problems that medical staff in situations like that are having to deal with?
Well, good morning, and thank you very much. Health workers and other frontline workers are obviously delivering invaluable, essential services, but as your report just showed, in very challenging circumstances and under constant pressure. So the kind of issues that can easily come up are accumulated stress, fatigue, burnout and exhaustion are some of the things we might expect as this second wave confronts us.
You know, I've got a contact working in a hospital who is finding it too distressing to talk about what's happening at work and having to just completely shut off from it when they get home. What kind of support is available for those people who are going in every day to keep all of us as safe as possible?
Yeah, great question. I think the first thing I would say is that we all, whether we're managers or co-workers, family members, even just community members, we can all can and need to show the empathy and the respect, kindness, compassion, as well as appreciation of the work that the frontline and health workers and other frontline workers are carrying out at this time. That comes across well from a number of the countries that we've been speaking to and working with in this specific area of how to better support the health workers. But also over the last few months, there has been considerable development of new tools and resources, apps that individuals can download, for example, self-care around managing stress and coping with that, mindfulness, also things like peer-to-peer support networks that can be really important so that people can share their concerns and anxieties in a group. And of course, we have helplines as well as more specific kind of counselling services for
I might be listening
staff.
to this, though, as a medical professional and say, well, actually, what I need is not a mindfulness book or an app. I need more staff, I need more rest, I need more support at work, and they're just not getting that. To what extent are the situations that are in the hospital actually just exacerbating the condition of the mental health of the people working there? And actually, that's where they need support, not just from their friends and family at home.
Yes, quite right. So, I was talking about what the health workers themselves can do to get help or support, but the role of employers or healthcare organisations here, I think, is vital. Of course, they need to ensure the availability of the kind of range of options for employer assistance that I just sort of set out, but also to be able, as managers and employers, to communicate clearly, but not excessively, about these about the services and also ensure confidentiality, which is really important, of course, in an area like this. Organizations can actually, managers become more sensitive and more capable in this area of mental health and psychosocial support and staff well-being, so kind of training amongst themselves. But finally, also introducing or revising policies to better support and protect health workers. This would mean, for example, if staff are under quarantine, ensuring that they are fully paid on those days, reviewing overtime and sick leave policies and so on, to ensure that the staff are well catered to and supported.
Thank you very much, Dr. Dan Chisholm, Mental Health Programme Manager at the World Health Organisation's Regional Office for Europe.